Concern mounting as health officials urge caution in the face of a spike in COVID-19 cases across the country. Officials of the National COVID-19 Vaccine Consultative Committee today disclosing what has accounted for the resurgence and what it will take to manage this health crisis. Keishla Adderley leads us off tonight.
We must simultaneously address the increase in cases, the identification of resistant strains, and adherence to the public health measures if we are to win this race and return to a sense of normalcy.
A strong statement on the script still being written on COVID-19 as cases spike once again. Consultant Dr. Mercelin Dalregis on what's to blame.
So new infections are being driven by international travel and a relaxed adherence to the health guidelines. The emergence of variant strains of COVID-19 is of significant concern. New strains have been identified from, you're well aware, the United Kingdom, Brazil, and South Africa, and most recently from India. These variants spread more easily and are infecting younger age groups. The cases may be more severe, and some countries are reporting more deaths.
Dr. Dalregis adds that the relaxation of protocols has also accounted for the spike, which saw 62 new cases reported on Saturday past and 55 on Monday. Dr. Dalregis also admitted that contact tracing has relaxed, but said it will be shored up.
We have called back all of those persons who helped us bring the pandemic to under 10 new cases a day to come back and help us. If we vaccinate many people, at the same time we accelerate the contact tracing and we practice the public health measures, we are optimistic, or we're hoping that we would see a plateau effect.
In the meantime, more doses of vaccine are on the way. So far, 21,000 doses have been administered, 16,394 in New Providence, 3,512 in Grand Bahama, 832 in Abaco and the Keys, and 638 in Eleuthera, for a daily average of 1,364 doses. The AstraZeneca dose, too, has been promised before the end of May. As for the other brands of vaccine, here's the reality.
The Moderna directly told us we could put in an order for 2022. And Johnson & Johnson, that's currently available, said that they don't have they don't have the supplies. But given that the COVAX facility, we benefited from the COVAX facility, we could not be in their queue to receive Johnson & Johnson vaccines.
Meantime, concerns linger over a Centers for Disease Control report advising Americans against travel to the Bahamas. Dr. Dalregis fleshes out what they're watching and what the local plan is to also triage ailing tourism.
They closely watch the new cases, the hospitalizations, and they're also monitoring the vaccine uptake. If we can stem the tide of the new cases, we can accelerate the vaccination, and it's May. We think that we would put ourselves in a position to receive a favorable response that promotes the Bahamas as a destination for tourists.
Keishla Adderley, ZNS Network News.